Welcome back to Hospice Talks with RC Hospice Care. My name is Ester. I'm one of the founders and COO of RC Hospice. I'm accompanied today by my directors.
My name's Kimi and I'm the Director of Patient Care Services.
And I'm Timothy Henderson, the Assistant Director.
Today we want to tell you guys a little bit about our organization and what makes us different. So I'm going to have Tim start this conversation.
So I think one of the main things that make us different is our continuity of care. As a lot of maybe other agencies, you might be seeing 5 different nurses when on services. However, with our team, you'll be seeing the same nurse for your scheduled visits. The only time that you might see a different person is on call after hours or on a weekend or holidays. So I think that'd be one of ours.
Is it just the nurses who are continuity of care for us?
As well as our home health aides, our CNAs that go and see you, the social workers, and chaplains. That's all going to be the same people, so it becomes a family. The nurse will learn the name of your dog, they'll learn your name, and they'll know how to care for you properly in the full case.
Absolutely. What else?
I think another thing that makes us very different is we offer physical therapy. So Medicare regulations were funded by Medicare. You don't need to offer physical therapy. Home health would offer physical therapy, but we as a company, and I take pride working in a family organization, that it's not the bottom dollar. You guys.
No, never.
It's about the comfort and what we can do to be different. So offering physical therapy, occupational therapy, speech therapy when it's indicated.
Absolutely.
Maybe we're going to be sending out a bathing person more often because they need additional help. Maybe they cannot afford caregiving, so maybe we're putting somebody out to help get them times a week.
Absolutely.
Whereas if you're on home health, you're going to be lucky to get that 2 times a week.
Sure.
If you're lucky.
Actually, one of my favorite things about our organization is our wound care. Like a lot of hospice companies, because the patient's already passing, wounds are sometimes inevitable, but we have healed unstageable wounds. It's one of my favorite stories. I remember going in, and unfortunately there is that smell that comes from bad wounds, and it's so hard to take care of them. We had one who had 19 of them, and I will never forget that nurse. I walk in and she had every single wound accounted for, measured, draining, cleaning. She had all the products, and we've never cut corners on our wound care supplies.
We've even done wound vacs.
Oh my gosh, how many times we've done wound vacs. And I think the reason why we do it, as Kimi said, because we're a family organization, we're not trying to go through 50 steps to get an approval. Our company can make that decision right then when it counts. We're not waiting for somebody to go through the paperwork or the documentation. There's been so many times where if Kimi says, we need this, or Tim says, I think this is a great idea, we don't question it. They're the nurses, they're the directors of patient care, which means everything clinical goes through them. If they believe a patient needs something, we're going to make sure we get it.
Another thing that we cover that I think sets us apart from others is insure. So
we do.
It doesn't matter what your diagnosis is.
And we have all 3 flavors.
And it's covered. That's expensive. When you're on a limited income, you're elderly, or maybe you're caring for your mom or dad, there's a lot of money that is going out. And so our insure, all of our incontinence supplies are covered, and we do not cut corners. They're not cheap incontinent pads. They are nice brands.
They are
good quality, and we're not going to limit you on the amount that we're sending out. If you need more pads or you need more diapers because they drink a lot of water, that's fine.
That is. I want to elaborate on the insure. I remember my mom's actually the one who thought of the idea for insure when we first started. And that came because we had one of our relatives on hospice at the time. Not our hospice, a different hospice. And before our hospice even got accredited, my mom would just buy insure for the relative just because it would help. It's like a little bit of protein because they can't really eat anymore. A lot of times their taste buds aren't even the best at that point, or they don't even have an appetite. But insure's like a smoothie. The chocolate one's actually pretty good. I like the chocolate one.
It also takes so much more energy to eat, to chew. I'm tired. I'm exhausted. So
versus a straw.
We have patients that have lasted a year and they're drinking 3 insures. They're not eating food every day.
I know. That's amazing. Some people don't know what a wound vac is. I didn't know what a wound vac was. What is a wound vac?
So the easiest way to explain a wound vac, it's a machine that will go over a wound and help keep it dry and clean and heal much quicker.
Why don't other hospice agencies usually offer it?
Because you need a physician's order, and they can be a little complex to use, and they're very expensive.
And insurance on hospice does not cover wound vac, and that's why it's not mandatory for any hospice agency to get it. But if they do get it, they are liable for that payment.
Another thing that we cover that others probably do not, maybe one that I've ever seen, a PureWick.
And the other one that does cover it, they only cover the machine. And the wands and the catheters are the most expensive part. So we cover it fully. We're one of the only hospices that ever, I think, have in Sacramento for sure, fully. And we bring it at time of admission. We educate on it. PureWick's, the reason why I added it, I'll never forget. A nurse at a hospital asked me if we have it, and I said, "What is it?" It's a catheter that it's a suctioning catheter. External.
External, so it's not invasive.
And then I still hadn't gotten it. Again, this is year 3 of our hospice agency, so I'm still trying to understand what it is, because we do catheters for all patients that are internal, and we do condom cats for our male patients, but this is a different, it's a suctioning machine. Until one of my family members, again, my family has helped me make a lot of decisions on what to add to our program. They were in the hospital, and they used a PureWick, and when I asked them what makes it so good, they're like, "I'm still independent. I still feel like I'm taking care of me, not someone else." And that idea where I feel like people give up and they pass away faster when they lose their independence, or they lose themselves doing something.
They don't want to be the burden on the family.
Yes.
Now you're going to have to change my diaper. I did not ever want that.
Absolutely.
So it's a device that is used for male or female. External, it keeps them dry, decreases your risk for breakdown, for being in bed and in a wet brief or diaper.
We are 24/7, and we mean that. When you call us, you're always getting a live person, and 99.9% of the time, it's an RN who's answering the phone. We have never had an automated system because we understand that hospice is literally life and death. So if you're calling us, you need us. So our nurses are always available. Our staff is always available. Yeah, I think that's the best part about our agency. Yeah. I'll tell you another thing that makes us different. We make our agency different. I started the agency, I was very young, and it was my dad's legacy. We lost him at the age of 57 about 8 years ago. And experiencing hospice and knowing what it is, and it's unfortunate to lose a parent, but I feel like it makes me understand what you're going through or what your loved one's going through, and I'm able to be there and be present for you at that time. I can tell you that hospice is a beautiful thing. Kimi, she makes this organization completely different. Her expertise, our comfort kit, is unlike any other agency's comfort kit because we foresee every single symptom. So we're not running to the pharmacy or rushing to get it from somewhere else. We want to make sure you have it in the home when you need it. Tim makes this agency completely different. I think he's one of the youngest directors we've ever had in our company, and that I can't even explain. He has more insight, compassion, and empathy than I've seen in so many other directors or nurses.
It's his passion. It's not just a job. He was
really is.
Born to be in hospice.
So if you or your loved ones have any questions or need hospice services, please reach out to us at 916-858-1440. We look forward to talking to you and serving you.